Let me first thank the Nutrition Advocacy Committee of our chapter for inviting me as participant in this panel discussion. From the past speakers, we learned that this pandemic has gravely affected nutrition across the world, especially in countries like ours, low-income and middle-income countries. The strategies to respond or limit the spread of COVID-19 have also upset how we avail fresh, nutritious, and economical food to serve to our families. Because of this pandemic, more children are becoming malnourished due to the deteriorating quality of the food they eat, aside from interruptions in other essential services. What can be done? The objectives of my topic are to discuss the role of the pediatrician in promoting sound nutrition practices among children's caregivers in the context of the healthcare delivery system, and to give practical tips to pediatricians in the prevention and management of child malnutrition during the COVID-19 pandemic. Let me first define what a healthcare delivery system is. It includes all the institutions, organizations, people, and resources that help a particular group of people stay healthy. So that includes us as a pediatric society, us as a chapter, and us as individual pediatricians taking care of our patients. We pediatricians have the essential and privileged role to help families start the very young on the path to healthy food choices and eating practices, with or without the pandemic. Parents and even grandparents look up to us for guidance in the feeding and nutritional problems of their children. So we can and should support and be involved in government programs or advocacies promoting good nutrition like the micronutrient supplementation program. Ito po yung vitamin A given during 6 months sa centers, the dietary supplementation program or the feeding program to school for the malnourished children, and the promotion of proper infant and young child feeding practices, which is actually breastfeeding. We should share correct information that would strengthen the caregiver's resolve to provide good nutrition to their child kasi bawal ang fake news. Examples of these websites are the WHO, UNICEF, the DOH, and of course, the PPS-STC YouTube channel. So please like, subscribe, and share on your FB pages to our caregivers so that they can have access to a wide variety of tips on child feeding. We also have our healthy baon box tips. I hope you still have this in your computer or in your clinics. This is designed to help our moms make healthy baon choices for their school-age kids based on the 5 different food groups. So nandito po mga bawal at mga pwedeng isama at ilagay sa kanilang lunch boxes. And during this pandemic, we can still educate our mothers through Mother's Class webinar. We can encourage the schools to participate in our Sigla sa Eskwela, and during our face-to-face or teleconsultations, we should commit time to ask about feeding practices during well baby visits and suggest food to take during illness. Kaya nga, we must be firm believers and advocates of good nutrition. How to prevent malnutrition during this COVID-19 pandemic? Let us first find the reasons or causes of undernutrition. The basic causes would be inadequate financial, human, physical, and social capital. That eventually would give an underlying cause of household food insecurity, or inadequate care and feeding practices, or unhealthy household environment and inadequate health services. This would give the immediate cause of inadequate dietary intake and also disease. Pag ikay nagkasakit, hihina ang pagkain mo. Pag hihina ka sa pagkain, hihina ang katawan, mas madali ka prone ka to infection. It's a vicious cycle. So, dito pa lang sa inadequate feeding practices and household food insecurity, I hope we can do something about this. UNICEF is alarmed on the devastating effects this pandemic has on child malnutrition. They outlined 5 urgent actions to protect children's right to nutrition in the COVID-19 pandemic. These are to safeguard and promote access to nutritious, safe, and affordable diet, invest in improving maternal and child nutrition through pregnancy, infancy, and early childhood, reactivate and scale up services for the early detection and treatment of child wasting, maintain the provision of nutritious and safe school meals for vulnerable children, and expand social protection to safeguard access to nutritious diet and essential services. They have allocated 2.4 billion. That would include an essential package of 4 life-saving interventions: prevention of wasting of children at risk, treatment for children who are wasted, biannual vitamin A supplementation for children aged 6 to 59 months, that would give 90% coverage, and mass communication for the protection, promotion, and support of breastfeeding that focuses on caregivers or families of children aged 0 to 23 months. Of the 4 life-saving intervention, anong pinaka doable and would give the maximum impact against the prevention of malnutrition? Siyempre, di ba? Exclusive breastfeeding. We should promote parate exclusive breastfeeding for 0 to 6 months while practicing good hygiene during feeding. We suggest the moms to wear a mask during feeding, wash hands with soap before and after touching the baby, and wipe and disinfect surfaces regularly to avoid the spread of the virus. After the exclusive breastfeeding, we should also encourage adequate complementary food and continuous breastfeeding for up to 2 years. Complementary feeding should be timely, adequate, safe, and properly fed. Sa mga 6 to 8 months, they should be given 2 to 3 times a day of pureed or mashed fruits. 9 to 11 months, 3 to 4 times a day with beets. And 12 to 24 months, 2 to 3 times, plus 1 to 2 nutritious snacks of the same food as family. I got this from the Academy of Nutrition and Dietetics Foundation, but I think this is at Central America. This is an infographic para sa 6 to 9 months, showing na mashed fruits, and then to 9 to 12 months, showing the food to have beets already. Starting 0 to 6 months to give you exclusive breastfeeding, and then to start the complementary feeding at 6 months with pureed or mashed food. 9 months with food with beets, and then 12 months with the food same as family. I hope we can also come up with something like this so we can show our moms or caregivers on what to give to their child when 6 months come up. We should also practice good hygiene, hand wash to prevent the spread of the infection, and oral care that would translate to better eating. Supplements also can be given to certain age groups, like the folic acid for the women of reproductive age, iron for anemia starting at 6 months, zinc supplementation to prevent bronchopneumonia, morbidity, and diarrhea. Vitamin A also for diarrhea and disease. Also, we should promote immunization against pneumonia, measles, and diarrhea, because this we know can give a significant impact on the health and nutrition of the child. We should also encourage access to clean drinking water. However, there is also the other side of increasing incidence of overnutrition or obesity. Surveys done in middle and high-income countries have shown that intake of cheap, red meat, fried and sweet foods, and sugary drinks have increased during the lockdown. There was also noticeable decline in the consumption of fresh food, fruits, and vegetables. This poor diet quality with a sedentary lifestyle may not be easily reversible for children and their parents, and may predispose them to early onset metabolic problems if not acted upon. So how do we break this bad eating habit? We lead by example. Lead by example. Encourage the moms to go back to eating fruits and vegetables and show them that they are enjoying this to their children. Set meal times and be consistent about it. Kung 7 o'clock ang dinner, 7 o'clock ang dinner, and do not encourage in-between snacking. Serve home-cooked meals and involve your child in the preparation. Kasi kung nag-invest ang bata ng effort on food preparation, they may be encouraged to eat their meals, home-cooked meals with vegetables. Tapos introduce veggies early. Totoo naman, these moms, the caregivers, would introduce vegetables at 6 months to 1 year old. Sino nga lang, pag nag 1 year old na si baby, napakain na ng icing ng cake, napatikim na ng french fries, nabigyan na ng Marie biscuit, and eventually Oreo and chips after. Kaya nawala na yung kanilang desire to have vegetables, and na-shift ang nutrition and preference nila to sweet and salty food. But please encourage them to not give up. Be firm. Kung ayaw ng bata, ulit on another day. Have an active lifestyle even at home. Marami namang pwedeng gawin. They can do TikTok dance, the mother and the children. They can do Zumba. They can do jumping ropes and hula hoops. Maraming pwedeng gawin even at home, even when they are in quarantine. The management of malnutrition. First is, how do we classify malnutrition? We have two tools, the weight for length or height and the mid-upper arm circumference. Because of the pandemic, it is encouraged that we use the mid-upper arm circumference, the MUAC tape. We measure the mid-upper arm from the olecranon-process of the shoulder to the bony tip of the elbow. And then you get the mid of this, and then you insert your MUAC tape. Maganda to because it can be taught to the caregivers, and it's easily understandable because you have color indicators. The green would mean no acute malnutrition, the yellow would mean moderate acute malnutrition, and the red would mean severe acute malnutrition. The moderate acute malnutrition is between 11.5 to 12. Ito would be the best way to use during the pandemic kasi it lessens the physical contact between the caregiver, the child, and the healthcare giver. This is the IAMCI assessment for cases of acute malnutrition and the management. From the MUAC result, makikita nyo yung green, so no acute malnutrition. The yellow is divided into moderate acute malnutrition and the uncomplicated severe acute malnutrition. And then the red would be the complicated acute malnutrition, complicated severe acute malnutrition. Another innovation adopted during this pandemic is to lessen the follow-up of this child and probably schedule their visit para less ang crowding sa healthcare unit. In conclusion, the future of our country depends on the health of our kids today. Their nutrition during early childhood has short and long-term impact on physical, emotional, social, and cognitive health and development. And despite this pandemic, we must find ways to combat malnutrition, notwithstanding the risks and setbacks presented by this health crisis. Thank you for your kind attention.